The most astonishing aspect of the COVID pandemic was the audacious way governments assumed an increased responsibility for the health of their citizens. This had never been a part of Australian culture before, or the culture of any liberal democracy for that matter. But all of a sudden, there they were, assuming they knew what was best for each one of us health-wise. This was bad enough, but the moral superiority that accompanied it was even more nauseating. One of the most obnoxious examples of this, and there are many to choose from, is the tweet posted by Queensland Premier Pawle on October 13 last year. Addressed to Queenslanders who hadn't had their first dose of the vaccine yet, it said in a passive-aggressive italic graphic, "We've done all we can to keep you safe, but this next step is up to you. We cannot protect you if you won't protect yourself. I need you to get vaccinated and I need you to do it now. It takes 5 weeks from the first dose to be completely vaccinated. 5 weeks from today is the 17th of November. That's getting very close to Christmas." The threat could not have been clearer. Get jabbed or you'll be spending Christmas Day eating a turkey sandwich alone, you ungrateful vermin. Pawle wasn't the only condescending megalomaniac to make these kinds of threats, but she certainly set the standard for the most matronly tone throughout most of the pandemic. How a whole generation of politicians assumed the same virtually unprecedented power simultaneously, even imbuing it with the authority to decide who gets to enjoy Christmas, is a matter that I'll have to look at separately another time. For now, it's their audacity that is being exposed. If you're going to assume so much responsibility over other people's health, then you really should know what you're doing. Turns out, they didn't have a clue. The Australian Bureau of Statistics released the nation's provisional mortality statistics on August 26, and they are an utter indictment on the pandemic response. In the first 5 months of this year, the mortality rate of Australians was 16.6% higher than the average for the previous 5 years, excluding 2020 for a reason I'll explain in a minute. So every level of government in Australia intruded on the health decisions of their citizens, and the result was not a decrease in mortality, but an increase. If ever there was a case for the reduction of the size of government, this is it. The Bureau of Statistics figures are these. The main increased causes were Alzheimer's and diabetes, both up 20% for the first 5 months of the year, and cancer, up 6%. There were about 75,600 total deaths in Australia during the first 5 months of the year, which was about 10,800 more than usual. That is an extra 415 deaths per week.